You just got diagnosed with rheumatoid arthritis, or maybe you have it for a few years and you still have questions that nobody has fully answered. Will this get worse? Can it be ever cured? Is it my fault? Will I end up in a wheelchair? Can I still work, travel, and live my life normally? I'm Dr. Diana Girnita, a board-certified rheumatologist with over 20 years of clinical experience. And today, I'm answering 5 questions that I hear most of the time from my patients with rheumatoid arthritis. These are the questions that will keep you up at night. These are the questions that most of you will type into Google or ChatGPT or Claude after you are diagnosed. These are the questions that I think every person with rheumatoid arthritis deserves an honest, direct answer. Not that kind of answer that is cautious, but it says nothing. I mean real answers. Let's go. Question number 1. Will my rheumatoid arthritis get worse? Now let me be honest with you, because you deserve honesty more than reassurance. Rheumatoid arthritis, it's a progressive disease. Untreated, it will get worse because the inflammation that it's attacking your joints right now will erode the cartilage, will damage the bone, and over time, these changes cannot be undone. And the inflammation doesn't stay in your joints. It will circulate through your whole body. It will increase your risk for heart disease, for lung disease, for eyes, and other serious complications. This is the hard truth. But here it is, the other truth. And this is the one that changes everything. With early, appropriate treatment, most patients with rheumatoid arthritis can stop the progression. Let me be clear. Not slow it down, stop it. I have patients who were diagnosed at 5, at 10, or even 15 years ago, who had never had joint damage visible on their image today because they were treated appropriately and aggressively early on. Because we hit the target and we kept them there. Because we adjusted when something stopped working rather than just waiting for damage to happen. If we look in 10 years from now, the single most important factor for your rheumatoid arthritis is not your genetics. It's not your age at the time of diagnosis. It's whether you get the right treatment, the right lifestyle changes, because yes, they matter. And if you have the right physician at the right time, and if you stay consistent with your treatment, even when you don't feel well, you will get better. So yes, rheumatoid arthritis can progress, but with the right treatment, it often doesn't have to. Now, the questions that most of my patients really want to ask, but they feel embarrassed to ask out loud, is question number 2. Can rheumatoid arthritis ever be cured? Or is this forever? This is the question I see on every patient's face at the first appointment. They want to ask me, but they are almost afraid of the answer. So let me give you the answer straight. Currently, there is no cure for rheumatoid arthritis. Please do not believe in the autoimmune gurus that will tell you that they can cure your rheumatoid arthritis. Rheumatoid arthritis is a lifelong condition that requires ongoing management. But remission is real, not theoretical, and it's not rare. Achievable for a significant proportion of patients with these modern treatment options that we have, and with incorporating a lot of the lifestyle changes. Now, what is remission? Remission means that you have no symptoms or you have minimal signs and symptoms of active disease. No significant joint swelling, no significant morning stiffness, normal or near normal inflammatory markers. And on top of that, a life that feels functionally like you do not have rheumatoid arthritis. And I have many, and when I say many, I have many patients in remission right now. who are running marathons, who are traveling the world, and they work demanding careers, and they also raise children. Yes, their rheumatoid arthritis is there, but it is being managed, and it is not running their life. In some patients in long-term remission, I can carefully taper their medications under very close monitoring. And for a small number of my patients, they can maintain remission without any medications. But this is not a guarantee. But they are actually real possibilities that did not exist for patients 20 years ago. Now, the honest picture, rheumatoid arthritis is lifelong. But what that life looks like depends enormously on how it is treated. And the goal that I set with every of my patients is not just to reduce pain. It is to get to the place where rheumatoid arthritis is something that you manage, not something that manages you. So, my friends, remission is real, and that changes the entire conversation. But patients often ask me what they can actually do for themselves beyond the medications to help them. And this is where science has gotten genuinely exciting. Let's go to question number 3. What can I actually do to help myself? Does diet really matter? Every single week, I get this question from my patients. Does what I eat actually make me feel the difference? Or is it just something that the wellness influencer will promote? And I understand your skepticism because there is a lot of noise out there. Miracle diets, supplement protocols that will promise you to reverse rheumatoid arthritis naturally. And there are a lot of people that will give testimonials that will sound too good to be true. And they usually are. So let me give you the evidence-based science answer. Yes, food matters, but no single food is a cure for rheumatoid arthritis. The Mediterranean diet has the strongest evidence base for reducing inflammation in rheumatoid arthritis. And when I say evidence science-based, I mean peer-reviewed clinical studies. Fatty fish like salmon, sardines, mackerel, which are high in omega-3 fatty acids, they can directly reduce inflammatory cytokine production. Olive oil, colorful vegetables, legumes, nuts, berries. These are all anti-inflammatory foods with measurable effects on the same biological pathway which will drive your disease. And I talk about all of this in my videos, in this channel, and also in my rheumatoid arthritis book. Now, what to minimize? Processed food, refined sugar, red meat, and ultra-processed anything. This will promote the same inflammation that your medications are actually trying to suppress. So every time when you eat this ultra-processed food, you are working against your own treatment. And alcohol. And I want to be direct here. Alcohol interacts with methotrexate. It will stress your liver, it will disrupt your sleep, and it will promote inflammation. And if you are on methotrexate and you drink regularly, this is a conversation that you need to have with your rheumatologist immediately. Now let's talk about exercise. Exercise is non-negotiable. I know this sounds counterintuitive when every movement hurts, but consistent, low-impact movement like swimming, cycling, walking, yoga, it will reduce inflammation. It will strengthen the muscles that will protect your joints, and it will fight fatigue, and it will cut your cardiovascular risk. Exercise is not optional for your lifestyle. It is part of your treatment. And then stress and sleep are also critical because chronic stress will activate the same inflammatory pathway that will drive your flare-ups. And sleep deprivation does it too. And this is not a soft advice because prioritizing sleep and managing stress are clinically meaningful intervention in patients with rheumatoid arthritis. And patients who do well and who consistently have better control, they sleep longer and they stress less. And one more thing that I have to say clearly, supplements help, but they do not replace the medication, the standard medication. Omega-3s, vitamin D, and turmeric, these have the strongest evidence that if you add them on, you may benefit. So lifestyle medicine in rheumatoid arthritis is not alternative medicine. Diet, exercise, sleep, and stress management have real, measurable effects on disease activity. And they work very well along with your medication, but not instead of it. Again, lifestyle genuinely matters, but it compounds over time. But one of the most common and the most feared experiences for rheumatoid arthritis patients, it's a flare-up. Now let me explain to you what is happening during a flare-up and what can you actually do about it. Question number 4. Why do I keep flaring up? What is actually happening? Flare-ups are biological events, not a personal failure. A flare is not because you are doing something wrong. And I want to say that clearly because so many of my patients will blame themselves for having a flare-up. A flare-up is a sudden increase in disease activity. It's when your immune system will surge. Inflammatory cells rush into the joints. Pain will increase, swelling will return, and stiffness that has been manageable again becomes very severe. And fatigue crashes back. And it can happen even when you are doing everything right. Now, what triggers a flare-up? Several things. Some of them you can influence, but some of them you cannot. Infections, even minor ones, like a cold or a respiratory infection, can trigger a rheumatoid arthritis flare-up because your immune system, already in an overactive state, it will ramp up further to respond to that infection. And then stress. Emotional or physical, major life events, sleep disruption. At that point, the stress hormone cortisol, when chronically elevated, eventually will lose the ability to suppress inflammation. And at that point, inflammation will come back harder. And then stopping medications or missing doses. And this is one of the most common triggers that I see. Patients will feel well, they think that maybe they don't need the medication anymore, they start skipping doses, and 2 or 4 weeks later, they are in a full-blown flare-up. Because rheumatoid arthritis does not give you a grace period. Then weather changes, specifically drops in the barometric pressure. They have been reported by my patients and by other patients for many decades. And the research on this is very mixed. But enough patients experience it and they take it seriously. And then eating a lot of sugar, drinking sugary drinks, drinking too much alcohol, or eating processed foods, they can also trigger a flare-up. What to do during a flare-up? First, contact your rheumatologist. A flare is a clinical information. It may mean that your current treatment needs adjustment. It may mean that you need a short course of NSAIDs or prednisone to bridge while your medication will catch up. It should not be managed alone with just wishful thinking. And then second, rest the affected joints. This is not the time to push through exercise. Protect that inflamed joint, use heat or cold that will give you some relief, and it will reduce the load on those joints temporarily. And then third, track it. When did it start? What was happening the week before? Did you have stress? Have you been sick? Have you been missed a dose? Because this is information that is clinically valuable to identify that potential personal trigger. So remember that flare-ups are manageable when you understand them. But then there is one more thing about rheumatoid arthritis that most patients are not warned about at the time of their diagnosis. And this is one that genuinely surprises them when it happens. Question number 5. Will rheumatoid arthritis affect more than my joints? And this is a question that I sometimes have to bring it up myself, because patients are so focused on their joints that they never realize that there are so many other things that could be affected. Rheumatoid arthritis is a whole body disease. And I want you to understand this, not to frighten you, but because knowing it changes how seriously you take your treatment. Rheumatoid arthritis patients have a 50 to 70% higher risk for cardiovascular disease than compared to general population. Not because of their medications. It is because of the systemic inflammation. Because chronic inflammation damages the blood vessel walls, it will accelerate atherosclerosis, and it will increase the risk for heart attacks and for stroke. And this is one of the most important reasons to treat rheumatoid arthritis aggressively and completely, not just to protect the joints, but also to protect your heart. And then it can affect your lungs. Rheumatoid arthritis can cause inflammation and scarring of the lungs. It is called rheumatoid arthritis-associated interstitial lung disease, and it is one of the most serious complications. And any new or worsening of the shortness of breath in a patient with rheumatoid arthritis needs to be investigated promptly. And then your eyes, scleritis and episcleritis, which is inflammation of the white part of the eyes. And then secondary Sjogren's disease, which can cause dry eyes, are both associated with rheumatoid arthritis. So if you develop eye pain, redness, or significant dryness, tell your rheumatologist, not just to your eye doctor. And then your bones. Rheumatoid arthritis causes inflammation that will accelerate your bone loss, and steroids will compound to that. Menopause will also compound it further. Bone density monitoring and bone protection measures has to be standard part of rheumatoid arthritis management. And it is something that I discuss with every of my patients. But none of these complications are inevitable. All of them are reduced by good disease control, which is why remission is not just about feeling better. It is about protecting your heart, your lungs, your eyes, your bones, and protecting your future. If you want to go deeper on living well with rheumatoid arthritis, the specific strategies, the inflammatory nutrition plan, the supplement guide, and the mindset shifts that separates patients who thrive from patients who struggle, I actually wrote a book specifically for you. This is called Thriving with Rheumatoid Arthritis, and it covers everything that I wish I could tell every patient with rheumatoid arthritis in one single appointment. And you can find the link to this book in the description of the video. It is the most comprehensive guide that I put together for patients who truly want to understand and who truly want to manage their disease, not just to take a pill and hope. And now, if you want to understand more about rheumatoid arthritis, from symptoms to the most advanced treatments and lifestyle options, I have put together all of this in this 10 minutes video. Yes, you take 10 minutes and you learn everything that you need to know about rheumatoid arthritis. So watch it here.